Welcome back. Now, parents are supposed to be the protectors of their children, but in recent times, we've seen children being murdered by their very own mothers. On one hand, a mother murdered her newborn baby, and on the other hand, a mother hammered her 4 children to death. So the question, are children safe in the hands of their parents? To discuss this further now, we are joined by children's rights advocate at the Teddy Bear Clinic, Dr. Shaheda Omar. Dr. Omar, thank you very much for your time here on eNCA. I don't know about you, but it seems to me with the amount of stories that we're covering, or I don't know if it's because we're seeing attention on these stories and maybe it's always been the case, it looks like cases of mothers killing their children are growing. We had that mother in Mpumalanga as well who had killed her 4 children and is serving a life sentence at the moment.
Indeed, I think if we just look at the historical process, cases of this nature were not reported. And we cannot confirm that it did not exist, but I think probably existed in isolation where it was undetected, where homicide investigations may have failed the process. But as we speak, and you have so rightfully articulated that we are seeing an increased incidence of violence being perpetrated against children by the very people that have birthed these children, that have raised these children, their own flesh and blood, which is unthinkable. It's inconceivable, and one cannot even begin to make sense of how to understand this gross violation, this heinous crime being committed. And what we call this is maternal filicide, where mothers are killing their children. We do see fathers as well, the paternal filicide, but it's just something where a mother is seen as the primary nurturer, the primary caregiver, the one who has carried this baby to full term and has gone through the pangs of delivery and has gone through many stresses and challenges in raising this child and other children. So, it's something that is absolutely shocking. It just sends goosebumps down one's whole body. It just leaves one in shivers. And I'm actually not only shocked, but I'm so distressed to even think that this has happened. And again, it's not the first time.
And I mean, we've seen even stories in courts, Doc, where mothers and the stepfathers of their children are found wanting. We've seen this case in Pretoria as well. Young babies, or small babies rather, dying because their mothers didn't say anything when their stepfathers were beating them at the age of 2, some of them 8 months, etc. But another thing I've noticed, Doc, with these cases is that it's always young mothers. For instance, the recent one who got 22 years in prison in Mpumalanga, 26 years old. The one who was sentenced a few years ago in Mpumalanga as well was 29 years old. This recent one in the Eastern Cape with her 4 children, just 32 years old. It's young mothers. Are we missing something here?
So you are raising a very pertinent point, because if we look at young mothers, we look at young mothers in relationships maybe having gone awry, the lack of social support structures or social support systems. Sometimes these mothers have actually struggled financially, but also if one looks at their coping mechanisms, maybe finding themselves in conflicting situations or situations where they are experiencing many challenges in survival, the influence of substances, or even when you try and unpack or interrogate, one questions like, what could motivate, what could drive any mother under normal circumstances to kill her own flesh and blood? The most, I think the glaring thing here is that the person feels totally trapped. There's no way out. There's no escape from the situation. It's desperation. It's a sense of hopelessness, helplessness, and feeling immobilized, that there's absolutely no way of coping. And that's why I speak to coping skills and the lack of support systems when, especially in younger people, they may not have the ability and access and to resources where they can reach out for help to say, these are my challenges. I'm not sure how to manage. I cannot cope with 4 children. It's too demanding. Everything around me is collapsing. And I think one cannot judge anybody. Yes, we have to separate the person from the negative conduct, the heinous crime, because at the end of the day, it's not the person that's bad, it's the action that's bad. It's the action that cannot be condoned, and it's unlawful and unacceptable. So there must be things that are triggering in this mother and these mothers, wherever they're coming from, that propels them to, respond in such horrific manners.
And without sounding like I'm protecting them because they're female, etc. I mean, this 32-year-old, for instance, there is no imagining what she did to her children with a hedge saw, or a hammer rather, and beating them to death while they're asleep. They had no power. They didn't know she was coming, etc. So it's definitely, and some of the children are poisoned. You trust your mother when she gives you food, and you'll eat the food with no question. So I'm not making excuses for them. But do you think, Doc, that the fact that we know that systematically the issue of women not getting the type of positions that they basically challenge men with, or even if you are CEO and a man is also CEO, you find out that the pay disparities are also quite bad, etc. Do you think that that's also another issue that could possibly see this not eradicated, but see this being sorted out somehow?
So what you've described here is one of the risk factors. I think there are numerous risk factors, and the lack of recognition, validation, and equal pay for equal work. I think many mothers are finding themselves in situations where they work much harder and receive much less. And of course, the inner sense of fulfillment as well, and the low self-esteem, eroding that low self-esteem, the feelings of worthlessness, not feeling appreciated in any way, could be one of the risk factors. And there are many other risk factors that one needs to consider. But just to also add that, waking in the middle of the night, where, as you describe these beautiful children, innocent, vulnerable children in their sleep, unbeknown to them what is coming to them. It also describes a moment of insanity, madness, which might have gripped this woman for whatever reason, because no normal or sane person would resort to that kind of horrible and horrific behavior, destroying in a very aggressive manner, and seeing what impact it leaves on the children. So it's something that one can definitely not accept, or one cannot even begin to fathom what happened.